Pelvic health is this big theme. It is complex, but definitely not complicated. If you're listening to someone talking about pelvic health, you're very likely to be talking or to be listening to a physiotherapist. Though we are not the only healthcare professionals working and dedicating study to this area, we're probably the only ones very proudly talking about pelvic health when we talk about structures, organs, functions that start in the pelvis or that are in the pelvis, but that definitely don't end in the pelvis. More and more, we are aware that the social and psychological condition of each one of us and of the communities where we are inserted play a very important role in our overall health. And the pelvic health is not an exception. Just for us to have a quick glimpse of how much the pelvis and the brain are related, I'm sure that all of us can relate to that tummy ache that we perceive just before an exam or just before something very thrilling or very exciting is about to happen in our lives. So, pelvic health is about the pelvis, but is not only about the pelvis. There's a lot or there's something of the pelvis there, but there's something more. And so, when we try to define pelvic health, of course, it's not easy. Of course, it's possible to define it from several angles, and probably is not the most important. But the important is to understand that there is research, there is practice, clinical practice that can help you if you want to know more about your pelvic health, or if you're already experiencing symptoms, or if you're already experiencing any dysfunction. What we are mostly concerned about is that after all the major diseases are ruled out, and this is usually done by your physician, we work together with your physician or physicians to bring back or to protect the function of the pelvic organs and structures and the overall systems that are related to it. So we are always looking after functionality. We're always looking to ways of improving the best function of your body, of your physical body. And of course, this will have a repercussion in how you feel as a person, how you perceive yourself as a person, and how much you feel that you are able to participate, to be autonomous, to be independent in your life, in your personal life, in your professional life, in your social life, how much you feel that you are thriving and not only surviving. Because that's what can actually happen when you're not able to or decide when it's time to go to the toilet, or when you cannot express your sexuality in a fulfilling manner. So, a lot of what is physical, of course, is related to who you are as a person, is related to your sense of normality. What is normal for you? What are you expecting from your body and from your body functions? And so, all of this has to be addressed when we talk about pelvic health. Of course, pelvic health support clinically and in terms of education is not worldwide available to everybody equally. But in many, many, many countries, in many geographical areas, you have pelvic health professionals ready and willing to help you either to improve your already very good standard pelvic health and acting preventively in order not to experience symptoms later on in your life, or willing to help you if you are already experiencing symptoms. Bear in mind that pelvic health issues, and described in research as pelvic floor dysfunctions, are still one of the largest unaddressed health conditions worldwide. And this is mainly because we don't talk enough about these situations. Everything that has to do with the proper function of our bladders, of our bowels, that is related to our sexuality are terms that we still find very private. And this is either amongst the general population as it is amongst the healthcare professionals. So, globalizing pelvic health is really necessary and mandatory. It's necessary for you to know that there is something to be done, for you to be in better terms with your pelvic health, for you to be more knowledgeable about your pelvic health organs, structures, and interaction of systems, as there is a lot to be done to help you to cope with symptoms and to help you to achieve what is your gold standard of a proper and thriving life.